A diabetic foot ulcer is a sore or open wound, and it occurs in about 15% of all diabetic patients. It's usually found on the bottom of the foot or leg. Anyone who has diabetes is at risk for developing a foot ulcer. In fact, diabetes is the leading cause of non-traumatic amputations in the lower extremities. Approximately 14 to 24% of Americans with diabetes who develop a foot ulcer lead to an amputation. Ulcers form due to a combination of factors, including lack of feeling in the foot, also called neuropathy, poor circulation, irritation such as friction or pressure, and trauma. Once an ulcer is noticed on the foot or lower leg, it's important to seek podiatric medical care immediately for several reasons: to reduce the risk of infection and amputation, to improve function and quality of life, to reduce healthcare costs. When villager Charles Penniman noticed a diabetic ulcer on his foot, he headed straight for Tri-County Foot and Ankle for care.
We actually looked up through our Blue Cross Blue Shield plan, and we found Tri-County, and that's how we ended up finding Dr. Wassel. I'm diabetic, and I developed a diabetic ulcer on my foot. So I went in to have him check it, to get it treated, and it became very complicated. I was always very active, and I've always been a big outdoor person, camping, fishing, hunting, doing things with the family. The biggest thing that I had to get through was slowing down long enough to be able to allow this foot to cure, because if not, then I was not going to have that type of active lifestyle ever again. He had me coming in continuously at least once a week, sometimes twice a week at the beginning, and we would go through everything, and he explained the situation. Dr. Wassel was a fabulous doctor, and I can say that about him because not too many doctors give you out their cell phone number. I don't care what time of day it is. He says if something comes up with you, we will figure out somehow to take care of it immediately. I can say that when there was one time when Dr. Wassel was out of town and he referred me to come in and see Dr. Rosa, and she was so upbeat and bubbly and encouraging, and the whole office staff there at Tri-County, I can't say enough about them. The friendliness and the encouragement, and we just continued to do exactly what Dr. Wassel was recommending, and he kept watching it and adjusting my medicines, and as I said, just a fabulous ending to a terrible story. I have been able to resume 100%. I have no problem with walking. I have no problem with doing my day-to-day things. I take care of any other things that come up that need to be done. That is what I very much so admire about him and the people of Tri-County. It became more than just you're a patient.
You'll find information for Tri-County Foot and Ankle when you click the Ulcer Alert Story Link icon on our homepage at yourhometownhealth.com.